All right, so for our last subject in our reproductive system lectures, I want to talk about sexually transmitted diseases, or why you should always use a condom. Always. For those of you who are saying, but I'm in a loving, committed relationship, let me just remind you that Jay-Z cheated on Beyonce. Beyonce. Enough said. All right. We're going to start with the bacterial diseases. These can be treated with antibiotics. They are curable. Remember, bacteria are alive, so we can kill them with anti-life drugs. So the first of those is chlamydia. It causes genital discharge, itching, and or painful urination. Women sometimes have no symptoms. Gonorrhea causes genital discharge and painful urination. Again, women sometimes have no symptoms. This means that a woman could have it, be passing it on to her partners, and not know it. So again, use a condom. Syphilis causes ulcers or sores on the genitals, and if left untreated, will spread throughout the body and can cause insanity and death. This is something that did kill people before the discovery of antibiotics. So syphilis is not something to mess with. If left untreated, syphilis will kill you. Syphilis also sometimes causes ulcers or sores elsewhere on the body in the first couple in the early stages of the infection, and then will go away for a number of years and then come back. So if it is untreated, so it is something to be tested for and to get treated if it's found that you have it. For those of you who are thinking this looks like a little worm, it's a spiral shaped cell. That's the kind of bacteria it is. All right, so chlamydia, gonorrhea, syphilis, those are the three most common bacterial diseases. Those can all be treated with antibiotics. Now, we do have treatments for other sexually transmitted diseases. Trichomoniasis is an infection caused by a protist or a parasitic protist. It causes vaginal irritation, itching, and discharge, and this time men might not have any symptoms. So again, a man could have it, be passing it to his partner, show absolutely no sign of it, and not know it. So it's good to, if you have had multiple sex partners, get tested. Candidiasis is a yeast infection caused by Candida albicans, and it causes genital irritation, itching, and discharge. Now, some people do get candidiasis non-sexually, and it is actually can be an eye infection as well. And in fact, it's actually very common in koalas, of all things, and can be actually fatal in koalas. So now there's something you didn't know. We do have antifungal infections, or fungal medications that we can treat candidiasis or a yeast infection. Now, you can also get yeast infections in the genital area non-sexually. A lot of women get yeast infections after taking antibiotics, oddly enough. So remember, yeast is a eukaryotic single-celled organism. Okay, it's not a bacterium, but your skin is covered with both yeast and bacteria all the time. When you take antibiotics, they kill off all the bacteria. They aren't selective about what kind of bacteria they kill. And in the genital region in particular, people tend to have a lot of yeast and a lot of bacteria that sort of are constantly battling with each other to see who, can be more numerous. In the normal course of events, neither wins. When someone takes antibiotics for another infection, it kills off the bacteria, and then the yeast in the genital tract can then multiply without competition, and then that can lead to a yeast infection. So again, a yeast infection is caused by overgrowth of yeast cells, which are a eukaryotic organism. So you can't treat a yeast infection with antibiotics. You have to have a fungal medication to treat a yeast infection, but it's sometimes caused by taking an antibiotic for another infection. Okay, hope that makes sense. All right, now viral diseases. Viral diseases cannot be treated with antibiotics because remember, viruses aren't alive. Therefore, something that kills live things can't kill antibiotics, or can't kill viruses, excuse me. Herpes causes blisters on the genitals. Once you have herpes, you will continue to get outbreaks throughout your life. We can give you antiviral medicines that will decrease the frequency of the outbreaks and decrease the severity of the outbreaks when they occur. But once you have herpes for the rest of your life. And it is a sexually transmitted disease. It can be passed on to partners. It has been linked to cervical cancer, to miscarriage, and to birth defects, especially if the mother has an active herpes outbreaks when she gives birth, and she gives birth vaginally. That can actually cause the virus to infect the baby in other places, not necessarily the genitals, and that can lead to developmental defects. So again, be careful out there, use a condom. Now, when a person doesn't have an active outbreak, it is very unlikely that they pass on the herpes virus, but it's not impossible. And there are two strains of herpes, one that infects the genitals and one that infects the mouth, and that one causes cold sores. They are very closely related and can mutate. So a person with cold sores can pass that to their partner's genitals through oral sex. So if someone has a cold sore, don't participate in oral sex with that person. Okay. All right. Human papillomavirus. It is HPV. It causes genital warts, and it is a cause of cervical cancer. Where there is now a vaccine for HPV it's recommended that it be given before the first exposure to the virus. They actually recommend that children get it at about age 9. It requires 3 shots, and the shots are quite painful. So I think it's good to just get it out of the way. But some people get like the first 2 and then don't want to go through the third because it hurts. Please, you have to get all 3 in order to have protection against HPV, and it is a known cause of cervical cancer. So boys and girls need to be vaccinated against HPV because, of course, you don't want males spreading it to females. All right, and then finally, HIV, the human immunodeficiency virus, is the virus that causes AIDS. And AIDS is a particularly insidious disease because it specifically infects the cells of the immune system. So it infects the white blood cells that tell other white blood cells what to do. And it tells them not to do their jobs. So that is why HIV is such a heartbreaking disease, because people if the HIV does develop into AIDS, then their immune system can't fight off other infections. So again, the only way to stop the spread is condoms, and getting tested and making sure that you're not passing it on to partners of yours. Okay, so that's the end of that. That was a nice short little video. And that's the end of our reproductive lecture.